Assalamu alaikum wa rahmatullahi wa barakatuh. This is Najwa Hussaini with Azadi News. Burma says it will take back Rohingya from Bangladesh. Report documents Burmese army rape of Rohingyas. Burma has told China it is willing to take back Rohingya refugees currently living in Bangladesh, according to the Bangladeshi Foreign Ministry. In a statement, the ministry said China's top diplomat Wang Yi conveyed this information to his Bangladeshi counterpart, A.K. Abdul Mu'min, in a phone call on Thursday night. Chinese Foreign Minister and State Councillor Wang Yi said that recently Myanmar had once again assured that the displaced Rohingya would be returned to Myanmar, said the statement issued on Friday. Burma informed China that it will soon hold talks with Bangladesh on the repatriation of Rohingya refugees, it added. Wang said Beijing has remained in touch with Burma on the Rohingya crisis, assuring Mu'min that envoy-level talks between Dhaka and Naypyidaw will be held after Burma's election in November, the statement said. That will be followed by a tripartite minister-level meeting between China, Bangladesh and Burma, the statement quoted Wang as saying. The Chinese and Bangladeshi diplomats also discussed other issues, including coronavirus vaccine efforts and post-pandemic economic recovery. Bangladesh is currently host to over 1.2 million Rohingya, who have been described by the UN as the world's most persecuted people. A new report from Physicians for Human Rights (PHR) has documented widespread sexual violence committed by the Burmese military, the armed forces of Burma and Burmese security forces against the Rohingyas. The massive campaign of violence in August 2017 drove more than 1 million Rohingya into neighboring Bangladesh. Doctors, nurses, mental health experts and other health professionals who provided direct medical services to Rohingya refugees in Bangladesh camps, gave accounts of the huge physical and psychological toll of sexual and gender-based violence on Rohingya women, girls, men, boys, and transgender and gender-fluid people. The research builds on PHR's work documenting human rights violations in Myanmar for more than 15 years, following the August 2017 clearance operation carried out by Burmese security forces and Rakhine Buddhist civilians in Rohingya villages across Burma's northern Arakan state. PHR teams conducted forensic examinations of survivors in what is now the world's largest refugee camp in Bangladesh's Cox's Bazar. The research teams gathered qualitative and quantitative data documenting the grave human rights violations committed against the Rohingya by Burmese armed forces, including long-term disabilities resulting from the 2017 operations. PHR's new report, Sexual Violence, Trauma and Neglect, Observations of Healthcare Providers Treating Rohingya Survivors in Refugee Camps in Bangladesh, presents qualitative data gathered through interviews with 26 healthcare workers from a variety of humanitarian organizations who provided direct care to Rohingya refugees in Bangladesh for some period between August 2017 and August 2020. PHR sought the perspective of healthcare workers in order to provide an independent corroboration of the patterns of violence sustained by the Rohingya community and to avoid potentially re-traumatizing interviews with survivors. These narratives from healthcare professionals are critical in providing additional evidence of the patterns of sexual and gender-based violence suffered by Rohingya refugees fleeing Myanmar at the hands of the Burmese military, said Ranit Mishori, PHR Senior Medical Advisor, Professor of Family Medicine at Georgetown University and co-author of the report. Health workers' testimonies of the behavioral and mental health status of Rohingya survivors tell us was that these egregious acts of violence had a deep and long-lasting impact on survivors, significantly traumatizing them even years after the initial event, she added. Accounts from healthcare workers cited in the report also revealed chronic barriers to access to healthcare among Rohingya refugees, particularly regarding response to sexual and gender-based violence and associated impacts on physical, mental, and behavioral health. This is today's news. To get more updates about Rohingyas, subscribe to our YouTube channel and hit the notification bell. Visit our website azadinews.org and follow our social media accounts. Wassalamu alaikum wa rahmatullahi wa barakatuh.